Okay, now you can start.
Okay, sir. Okay, thank you. Right. So I think in the last class we had discussed till here. I discussed about what a case study is, and we talked about some very famous case studies which exist in the area of psychology. So today I'll discuss the advantages and disadvantages of case study method, and then I'll discuss the steps, specific steps, and then I'll demonstrate. Okay. So the advantages of case study include the following. So it can be published quickly. That's one of the advantages, because case study is, since it's a very in-depth study, if you can maintain the objectivity of the data reported and the interpretations are done properly, you can publish it within a short period of time, because you do not have to worry about many different things. You can just focus on one single thing and write about it. And it provides very, very detailed information. That's another advantage. It allows detailed investigation into situations which would be unethical or impractical to perform using another study design. You consider some particular example like it. For example, suppose a researcher wants to study, suppose this one, the ragging case which happened in Jadavpur University, right? So it's a very sensitive matter, right? And if suppose a researcher wants to investigate that what actually happened there, right? So in that case, it will be unethical if you just want to use some other methods like experimentations. Of course, you are not going to bring another boy in your lab and then make some a few other boys rag him or her to understand how ragging takes place. So we cannot do that, right? Also, you cannot really employ a method like observation in this case, because observation also, if you are just observing, being a participant observer there, and in front of you some crime is getting committed and you are not saying anything, that is also very, very unethical, right? So in such a case, maybe this particular method, case study method, will give you a more in-depth understanding of what had happened, the incident that that took place in their hostel, right? So you can collect data by interviewing people who were involved there. You can make notes, you can obtain pictures, and you can analyze the textual data and visual data, and take into consideration all those things together to understand what actually happened there. Okay, so in such kind of cases, situations, other methods may not be very much applicable. So also in our previous class, we were discussing about patients where maybe a patient is suffering from a particular type of particular psychopathology, maybe, or a brain lesion. Okay, and a researcher just wants to understand what is the consequence of that, behavioral consequences of that lesion in the brain that occurred, or maybe the patient is suffering from a tumor in the temporal lobe. So what are the behavioral consequences of it? So these are the situations where you cannot really use any other method. You cannot simulate the kind of situation in a lab. It's unethical, it's impractical, and it's kind of impossible as well. All right, so in such kind of cases also, case study definitely is a most appropriate method to do an in-depth investigation. All right, so these are some of the advantages. Disadvantages may include researcher bias. Okay, so a researcher bias can, can arise if the researcher is not being completely objective in his or her approach. Okay, if the researcher has some preconceptions about a particular phenomena. Okay, for example, let us consider a situation where a researcher wants to study, say, female feticide. Okay, um, in the remote areas of maybe Rajasthan, which is a very common incident that takes place there every day. So a researcher wants to study something like that. Okay, what leads to this female feticide, right? So there, the if the researcher has some preconceptions about the attitude of those people, that maybe the researcher is having a feminist approach and is quite negative about people living in the remote areas of Rajasthan right from the beginning. Okay, so in that case, the entire process will get affected due to the attitude of the researcher himself or herself. If the researcher thinks that, okay, these are the people who kill, babies, if there are, who kill their daughters, okay, who kill their babies right after the birth, so they are murderers or something like that. So if the researcher, um, you know, has some kind of negative attitude right from the beginning, that will definitely influence the entire research, entire data collection process and the interpretation, right? So even though the researcher is having a negative feeling or negative attitude towards those people, the researcher needs to maintain a very, very neutral position in this case, just to be the observer, just to collect the data neutrally and interpret it as much as possible in that way. But yes, in the practical situation, it is not always possible, and that's why researcher bias can affect case study method. Not only case study method, in other qualitative data collection methods also, researcher bias can become a very significant problem. All right, so difficult to replicate. Okay, replication is another problem if we are talking about case study method. Why? Because each case study has its own shape, its own format, its own niche, I would say. So in that case, suppose one researcher is conducting a research on a particular problem, another researcher, uh, even though is trying to replicate the problem as much as possible, there will be many differences, because in case study method, we look at the incidents as they are occurring. We do not try to manipulate or modify situations as we go, right? So that's why it is quite difficult to replicate one particular case study at a later stage. All right, can't always be generalized to the broader population. Okay, this is another consequence of not being able to replicate the case study. We cannot really generalize case studies all the time. So case studies um, generally talk about the exceptional incidents which take place around us. Okay, so the case of Phineas Gage is one of its kind. It doesn't happen like that. For someone, if this kind of an incident ever happens to someone, person will is going to die. Okay, that's how it is. But somehow Phineas Gage survived. All right, so this particular case study is one of its kind. All right, so generally all case studies are have this uniqueness. Okay, whenever you will be studying one particular case study, you will see that it has its own uniqueness, and that's why it is studied in individual context, not in a group context. We do not group different studies together and we call them case studies. We do not do that. We look into one single individual, one single context, one single situation, one single incident at a time, and we do a case study, right? So that's why it is quite difficult to generalize the findings to a mass population. All right. So these are some of the advantages and disadvantages of case study method. All right. Let me know if you have any question at any point. All right. Or you can write it down in the chat box as well. So we will now start discussing the steps of conducting a case study. And I've given the reference of this particular study here, Rashid et al. 2019. It's a a very detailed description of the steps which we follow in a case study, in conducting a case study scientifically. So they provided 4 different phases. They, it's kind of like a checklist for 4 different phases to conduct the case study. The first is the foundation phase, which includes the philosophical consideration, inquiry techniques consideration, research logic consideration. Then the pre-filled phase, which includes the decision-making process and the case study protocol. Then the filled phase, which has 2 stages, contact and interact. And finally, the reporting phase, which includes the case study reporting. So we will see each of these phases in brief details. Okay, the foundation phase. Right. So here we start with the philosophical consideration, right? What is this philosophical consideration? Every researcher should familiarize, understand, and develop a stance that will eventually reflect in the mechanics of the research method. Okay. So right at the beginning, we need to, decide on the philosophical considerations. What is the underlying philosophy of conducting this case study? Okay, where are we going? Is it going to be what is the underlying philosophy that we are looking into? Are we concerned about the population at large? Are we looking at the event as a single exceptional event that has occurred? Are we looking at it from positive approach? Okay. Can we have everyone muted? Thank you. All right. So that's the first step before conducting any case study research. All right. So the researcher should be absolutely familiarized. This familiarization can occur through reading, through review of literature, through interacting with experts. Okay, understanding the phenomena as a whole, that is the most important thing. Okay, so this familiarization should take place right at the beginning, and then developing a stance, a standpoint, which will be reflected in the entire research method. Okay, so that's the first step, philosophical consideration. Second, inquiry techniques consideration. So there are 2 common inquiry techniques which are available to researchers while undertaking a research project. One is quantitative and another is qualitative. Right. So inquiry technique section is somewhat affected by one's own philosophical stance. How? If one is taking a stance which is positive in nature, positive stance means, positive philosophy means the researcher will believe that okay, this phenomena or this event is a generalized process. It occurs largely at the population, and in such cases we go for quantitative approach. Okay, we look into numbers. All right, but on the other hand, if our philosophical stance is more not positive, but more into, an abstract form. If we are more into, what they call the epistemology, okay, or ontological approach, all those things, if we are concerned about, okay, if the philosophical stance is something like that, then we go for a qualitative approach, because there the basic approach will be more of, understanding the phenomena, looking at it, into, from a different perspective altogether. Uh, we do not really look into numbers in that case. Okay, so these are some of the philosophical considerations which uh, influences the different inquiry techniques which we consider at a later stage. All right, so this inquiry techniques actually depends upon our own philosophical considerations. All right, okay. Then the research logic consideration. Okay, so research logic here, generally we know about induction and deduction, inductive knowledge and deductive knowledge, like that. So deductive research logic begins with a theory. So you already have a theory, okay, and you are conducting the case study for testing the arguments. That's the deductive logic. Okay, so I'll give you an example here. Suppose the basic understanding is that, or the theory is that, people are, suppose people are attracted to others who are more similar to them. Okay, suppose this is the underlying assumption, the theoretical assumption that we already have, and we are conducting a case study research in order to verify or test this particular argument. Okay, so there the entire logic of conducting this case study will be based upon this underlying theoretical assumption. So we have certain pre-assumptions and we are testing such assumptions in conducting the research. That's the deductive research logic. Whereas the inductive one actually starts with the understanding the phenomena itself, exploring the subjective accounts of lived experiences, and building a theory on it inductively. So in inductive logic, the phenomena is studied, okay, the patterns are recognized, and on the basis of those patterns we form assumptions, and on the basis of those assumptions we form a theory. Okay, so these two work in opposite directions. In deductive research logic, we start with a theoretical assumption and we test it in our research. On the other hand, in inductive research logic, there we start with the phenomena itself, try to identify the pattern in which things are occurring, and then we form certain assumptions which finally builds the theory at a later stage. So for example, Freud's theory as we know it, it is based upon this inductive logic, right? So Freud studied little Hans and many other patients like that. Okay, we know the very famous case studies are there. If we go through Freud's work, we will see that some very, very interesting case studies were done in Freud's work, and Freud explored the lived experiences of his patients. Okay, how things are happening, what are they dreaming about, what are they thinking about, what were the past experiences, and all those things he explored. And on the basis of those lived experiences, he formed certain assumptions. Okay, and on the basis of those assumptions, he built his theory. Okay, so that's the inductive logic. That's how the inductive logic actually works. All right. A third type of research logic is also there, which we call the adduction. Okay, so this is a comparative table that I have provided for deduction, induction, and abduction. Okay, so abduction is basically, it's also referred to as systematic combining. Okay, so this is different from deduction and induction in that this is basically used to understand social phenomena in terms of the social actors' motives and understanding. Okay, while deduction is used to test theories, to eliminate false ones, to corroborate the survivor, and induction is used to verify the theory by searching for the facts and to establish descriptions of the patterns. Okay, so in abduction, we look more into social phenomena. Okay, and we try to understand the motives and understanding of the social actors, the people around us, the subjects. Okay, so it starts with the the related theories, observation of everyday accounts, and finally on the basis of this we form tentative theory or framework. Okay, which actually develops from the researcher's stance. The stance is inquiry from insight. Okay, it's like induction. So in induction also we it's different from both deduction and induction. Induction and deduction are similar, where the inquiry is from outside. Okay, but in abduction the inquiry is from inside. Okay, so the researchers insight about the phenomena which is happening is more important in this case. Okay, and respondent actually view explained by the researcher. Okay, whatever we talk about, whatever logic we follow in abduction, it is the respondent's view which is explained by the researcher, while the deduction and induction is actually dependent on the researcher's viewpoint. All right, so both in deduction and induction, we give more emphasis on how the researcher is perceiving the event that is occurring, whether it is to test a theory or to build a theory. Okay, in both cases, it is the researcher's perspective, researcher's insight, which is of more importance. On the other hand, in abduction logic, it is the subject's perspective. Okay, the perspective of the people, the subject who is being studied, that is the main focus, which is explained by the researcher. Okay, so that's how these three different logics are, research logics are different among each other, and case studies are actually built on this type of research logic. So first thing that we need to do is to in this foundation is, therefore we start with philosophical stance that we are going to test. Then the inquiry techniques, we have to make sure whether it is going to be a quantitative one or a qualitative one. Okay, definitely a qualitative one is required if we want to do a case study method. However, in certain cases, one can be combining qualitative inquiry with a quantitative inquiry, okay, in order to understand the phenomena as a whole. And also the research logic, we have to be very much clear about whether we are going for testing a theory or building a theory, or to understand the phenomena from the subject's perspective. That we have to be very much clear about right at the foundation phase. Okay. Next is pre-filled phase. Okay, the second one. So pre-filled phase is where firstly we make certain decisions. So the first step is to ascertain whether case study is the most suitable choice as a method. So case studies are a preferred strategy when the researcher has little control over events and when the focus is on contemporary phenomenon within some real life context. Okay, so this one we have to decide in this pre-failed phase. Okay, so you might be thinking that, okay, when we are already conducting a case study, why do we need to make a decision about whether we are going to conduct it? So we are already decided. see, sometimes it happens that when we go into qualitative inquiry like this, it might seem that, all right, this is probably the most preferred method. But then again, okay, you have to reflect on it and you have to think about it, whether the one which I have decided to conduct, whether that is the most appropriate method or not. Okay, there are certain cases where case study is not possible. Okay, you cannot do a case study in such kind of research. Okay, for example, if you're suppose if you're say the preferred logic, research logic is inductive in nature, so you want to build a theory. Okay, but in order to build a theory, you need to understand a pattern of behavior. Okay, now you cannot just study one single person and develop a pattern out of it. For example, suppose a forensic psychologist wants to understand the pattern of behavior that is manifested among serial killers. Okay, and maybe the research question is to understand what makes a person a serial killer, right? Now, in order to understand it, to study this, the researcher might think that, all right, I can do a case study on serial killer, on a serial killer, and I can be able to understand why a person is committing a crime like that. But here, since the logic is inductive, okay, when I'm saying that I want to understand why a person becomes a serial killer, so definitely, therefore, my logic is not deductive in nature. It's rather inductive. I want to identify a pattern in the behavior, the causes, the underlying causes, which is leading to that particular pattern, and that pattern is making the person a serial killer. Not every person who is committing a murder is a serial killer. There are certain specific parameters which needs to be fulfilled. So what are the underlying causes for it? So in order to understand that, the researcher, if focuses on only one single serial killer, then it's a mistake. Okay, that will not be a very much appropriate strategy in that case. Probably the researcher will have to study a number of serial killers from different backgrounds with different stories. And then only the person will be able to identify these underlying causes, the pattern, etc., which is leading a person to be a serial killer. So in such a case, probably interview technique and understanding the different case studies, the case histories, okay, the pattern of crime that was committed by the person would have been more suitable. Yes, semi-structured interviews, right? So such kind of method will be more suitable for such kind of an inquiry, right? So thematic analysis, yes, probably thematic analysis. Uh, Maybe some other methods also can be followed. Okay, but thematic analysis will be good one in that case. So whatever be it, in order to understand such kind of a problem, a case study is definitely not a preferred strategy. So we have to make sure that whenever we are starting with a case study, the case study method should be fitting the problem appropriately. That's the first decision which you have to make. Once you are decided about you are going to conduct a case study, then you look into the second step, which is the case study protocol. So you develop a protocol. So what is this protocol? A protocol is a formal document capturing the entire set of procedures involved in the collection of empirical material. So it extends direction to researchers for gathering evidences, empirical material analysis, and case study reporting. So this can include the research question, research method, permission seeking, ethical considerations, interpretation process, and criteria for assessment. All these, issues you have to define accurately in this case study protocol. Okay, what are the research questions which you are going to ask? What is the specific research method you are going to follow? So in a case study, you can be combining different methods together. Okay, in order to understand, you can be doing certain assessments, you can be interviewing it, you can be observing the subject. Okay, you can be focusing on group discussions, whatever it is, you can be interacting with experts. So all these research methods which you are going to consider, you have to clearly define it in the case study protocol. Then the permission seeking, definitely it's case studies are very much sensitive. Okay, and that's why a lot of ethical considerations you have to consider here. Permission not only from the subject, but also it has to be cleared by the medical board and ethical boards which are there. So these permission seeking and ethical considerations are involved, and then you have to make decision about how you are going to interpret clinical profile on the basis of symptoms. Yes, that's that is applicable in the clinical setting if you are going for a clinical case study. Okay, but in other types of studies, other types of case studies also, you have to go for ethical considerations and permission seeking. Okay, interpretation process, yes, you have to clearly define what is going to be your interpretation process. How are you going to combine the data which you will be getting from different sources, and the criteria for assessment. Okay, whom are you going to assess? Okay, how are you going to assess? What are going to be the criteria for a particular conclusion? So all these things has to be clearly defined in the case study protocol. Okay, next, field phase. Okay, that's the third stage where you are actually conducting the case study. So the first step here, as mentioned, is the contact, which is being a qualitative study with interpretive stance. The involvement of the researcher in the process of empirical material generation and interpretation is crucial, right? So before collection of empirical material, it is useful if the researcher knows the cases well and the participants who will be approached. So that's the contact phase, okay, where you are getting to know the participants as a whole, right? So a good researcher will not just start and go and start questions, asking questions to the subjects or participants. A good researcher will not do that. Okay, he or she will first try to understand the history of the subject, okay, or the background of that particular phenomena that has occurred. Okay, and then we'll start with asking questions or collecting data. So before this empirical material generation, this empirical material generation means where we are actually collecting the data. Okay, so before collecting the data and interpreting it, the researcher has to know about the phenomena as a whole, the background of the participants, the cases, whatever you are considering. Okay, that you have to completely know. All right. So if you consider, for example, the the example of the serial killers which I gave there, if a researcher wants to conduct case study on a particular serial killer, okay, there the researcher will have to have a very good knowledge of how such kind of patients or such kind of criminals they think, okay, what is the background, what is this, a lot of things are there, like criminal profiling and identifying the pattern and all those things. So this background information about identifying crime, that knowledge should be there with the researcher. Otherwise, what will happen? Otherwise, the researcher will not be able to ask the appropriate questions, will be probably missing out important information from the crime scene, okay, or from the case history of the person. All right, so that's the difference between a researcher who is already having a background in forensic psychology and another researcher who is a novice in forensic psychology. Okay, so that the second person, the second researcher might have a background in psychology, but that does not makes him or her eligible to question a serial killer, because the knowledge of forensic psychology is not there. Right. So this is very important. First, we have to know about the case very well, the participants very well, the entire background should be known, and then the data collection should start. All right. Second is the interaction phase. So the case study method involves a range of empirical material collection tools in order to answer the research questions with maximum breadth. So semi-structured interviews can be conducted along with meeting observations, documents collection, all those things taken together. Collecting empirical material from multiple sources allows triangulation, where we are able to verify one information from different sources. All right. So this combination of multiple sources of empirical material in a case study method is best understood as a strategy to add rigor, breadth, complexity, richness, and depth to the study. Okay, so where we are combining all these different research methods together. Okay, so that allows us to collect lot of different information of different variety and verify the information from different sources. For example, suppose in a clinical setting, if you are trying to do a case study on a particular patient, suppose. All right, so the patient is telling you something. That's one form of information, right? How are you going to verify it? You are verifying it by interviewing probably the family members of the patient, the caregivers of the patient. Okay, again, you are verifying the same information by some testing method, like you are giving a projective test, and in the projective test, the kind of information that you are getting, probably it is also helping you to verify what the patient is telling you. All right, so there, you are combining all these different methods: interview method, semi-structured interview method, unstructured interview, then psychological testing, then observation of the patient, the history of the patients. All these different methods you are combining together to understand the phenomena as a whole, the case as a whole. All right, so that's the appropriate way through which we should be conducting a case study. All right. Finally, the reporting phase. Here, quality of case study actually, does not only depend on the empirical material collection and analysis, but also on its reporting. So it is, this reporting part is actually very, very important. Okay, so I remember in one of my previous workplaces, we had one, it was in the area of marketing research, but even though it's a marketing research, so there was this one expert who came, and we had a 2-day workshop. Okay, and this entire 2-day workshop was devoted to learn how to write a case study. Just that. All right, not trying to understand the steps of conducting case study and this and that, whatever we are discussing. That's the field phase, that's the pre-field phase, field phase, all those things we have discussed so far. But though that particular 2 days workshop was devoted only to make us learn how to write a case study, right? And it was hugely popular. It's a very, very meticulous process, because you have to present, case studies should be presented in such a way as if it's like a story that you are telling the readers, but with very much empirical support. Okay, so all the empirical evidence which you'll be collecting in your data collection phase, in the field phase, those are the evidences which will be supporting your story. So it's like that. So it's a very meticulous process, writing or reporting a case study. So a sound report structure along with story-like writing is crucial to case study reporting. Following points should be taken into considerations, like case description, okay, participant description, relationship descriptions, details of field protocols, empirical material interpretation and analysis, and conclusion. Each of these points are very much, it should be very much detailed and meticulous in its approach, very much scientific, very much objective as well. We should be very much careful about not to let our own attitudes and biases influence the writing that we are projecting in the case study reporting. All right. So there, the researcher has to be careful about presenting the case like a story, but at the same time, focusing on these or adhering to this particular structure which is defined here, and write the entire case study in a very, very objective and systematic manner with evidences, with supporting evidences collected through the data collection efforts. Okay, so that's how the case study should be reported. Okay, because in case studies, since we are looking into one single case and we are focusing on the uniqueness or the the exceptional what should I say, the exceptional factor, the X factor, I would say, of a particular phenomena or a particular case, it should be presented in a very interesting way. Okay, so that the whatever the researcher has felt while conducting the case study should be communicated to the readers as well. Okay, so that's how we should be considering the report writing in case of a case study. So if there are questions about the steps, you can tell me. So I'll just now show you this particular case study. Are there any questions as of now? All right. So you can see here. I hope this screen is visible to all of you. The PDF is visible. Can you please confirm?
Yes, ma'am, it is.
Okay, thank you. All right, so this is the case study of a 13-year-old boy suffering from depression and stuttering. Okay, so this is a published study, and I'll show you how they focused on these different aspects of the case, how they presented it. Okay, so the introduction part actually talks about the stuttering part. Okay, the stuttering as a symptom. Okay, why it happens. Okay, how stuttering can be related to emotional problems in children. So Then it talked about the diagnostic process of this 13-year-old boy who was who used to stutter and at the same time was suffering from depression. So they talked about childhood depression first. Okay, that's the background that they are creating. Okay, so the background of childhood depression, how it develops. Okay, what can be the underlying factors? All right, so uh, these were the background study which they presented for giving the readers a clear um, understanding of how childhood depression works. All right. Then they talked about the role of separation in the etiology of stuttering. Okay, so why stuttering develops in the first place? All right, so they talked about different research studies, okay, where they showed that, all right, separation from the mother can be an important or influential factor leading to the child stutter at a later stage. Okay, so presented different research findings which supported this particular viewpoint. Okay, and how stuttering as a symptom develops, what can be the underlying factors for it. For example, you can see they talked about separation from mother, then fear of losing some immediate access or close contact with the mother as a causal factor. They talked about a research study where stuttering was seen as a defensive reaction to the trauma of the child's feeling of separation from the mother. So all these were actually presented to build the background of how or when a particular phenomena occurs in general, not for this particular case, but in general how it occurs. Okay, so that's the background. Then comes the case study. Okay, so in the case study, they first described the case as a whole. Okay, how it all started. So they presented the problem of this 13-year-old boy. Okay, that he was referred to speech therapy because of his stuttering. He started to stutter when he was 3 years old only. And at that time, he also had bedwetting problems. All right. So in the early phase of the diagnostic process, it turned out that he had some serious emotional problems. He was often moody and sad without any reason. Sometimes he became irritable and withdrew from social situations. At that time, he lost his interest in school and was thinking about committing suicide, etc. So this researcher then presented that what are the different methods that they used. So in the examination process, they used first interview, then mother's report, then drawings, and then Rorschach. Okay, and explored this boy's intentions of suicide. Okay, so the first interview presented the findings from interviewing the patient, that is this 13-year-old boy. Okay, so it all started with describing how it, the problem came into the researcher's attention. So the grandparents called me. So the researcher is reporting the grandparents called me because of their grandson's stuttering. The mother and her son come to our first appointment. Then description of the boy. Okay, description of the mother. Okay, and then what were the things that the mother told. Okay, and what were the things that this boy talked about himself, or about his situation, about how he interacts in the school, what were his experiences in the school. Okay, so all those things were reported in this case. Okay, so how it all started. So the what were the the teachers, what was the reaction of the teacher, reaction of the friends, classmates. Okay, reaction of other parents. So all these were reported in this part. Then the mother's report, where the entire history of the child was collected from the mother, right from the birth of this child to till this 13 years of age. What all happened in this entire developmental phase of the child. Okay, so here you can see, as the facts have been reported that this particular boy was breastfed for 6 months, was walking at 9 months, and was toilet trained by three years. So they noted that the mother did not remember his speech development process. Okay, he did not fit in the nursery school, but later he managed to adapt to it. He was lonely in the school and did not have many friends. He began to stutter at 3 years old, and he had bedwetting problems when he was 4 years old. So all these descriptions were included in this part. Okay, how the problem developed and what were the different experiences, specific experiences or specific life events which might be playing an important role in this case. So all those things were reported here. Then the drawings. Okay. So the researcher actually used the draw a person house tree technique, HTP. As we know, it's a projective personality test, and it was considered. Then the draw a person test, it was also considered here. So you can see the descriptions are given. Okay, so the boy placed it in the center of the page. The lines were entangled. It draws the shape of the figure, especially the head, with more than one line. So you can see that multiple repetitions were done in this case. It is not looking for eye contact. It seems that the figure makes a vague step with his left foot. Okay, so that's the person that this boy Aaron drew. Then draw the house. So the house is schematic. The lines are also entangled. You can see multiple, repeatedly these lines were emphasized, and the house is not symmetrical. Okay. Then tree. The shape of the tree is also schematic. Everything is schematic in his drawings. Proportion of the branches in the trunk is suitable, but the branches seem more dominant than the trunk. Roots which symbolize the past are not visible, but this is customary in children because they're concerned about the present. The lines of the branches which symbolize the relation to people are entangled. Okay, so the drawings are presented, and family drawing. Drawing of the family also gives interesting information about the relationships in the family. They represent the unconscious desires and fantasies of the person. So in this picture, Mike, his mother, Adam, father, and him. So he draws himself on the picture at the last one, but his shape is the largest one. His two brothers stand next to their mother, and he stands next to his father. So this is the picture, the family picture that he drew. Okay. And he identified himself to be this one, the last one. Okay, the last person drew on the right hand side. Okay, but you can see this is the largest figure that he drew. Okay, so this is the fantasy family drawing for this particular child. The task was to transform his family into anything he wishes. So in his fantasy family, his father is a house. All right. The house is a home. The house symbolizes a feeling of safety. His mother has become a heart. The heart is a symbol of affection. Mike, the brother, is a pinball machine because he is a winner. Okay. It symbolizes his feeling that his parents prefer Mike over him. Adam is a mouse because he is the youngest one and less brave than his brothers. Aaron has become a TV box because he likes watching TV. So that's the fantasy family drawing for this child. Okay. Then the kinetic family. So the researcher reports that this one I found that asking children to draw their family during action is very informative. So this type of family drawings manifest the togetherness of the family. For example, if the family members act together, it can express their solidarity feelings for each other. So in his kinetic family, this mother of the child washes up the dishes. Okay, father digs a garden. Two brothers watches TV, and he separately watches TV in his own room. That's the kinetic family drawing. Okay. Mother-child. Okay, mother-child interaction. So this drawing points out the characteristic of the relationship between mother and her child. In this picture, they reach for each other, but they are not attained each other. So they're not able to reach each other. Okay, that is what we can see from this mother-child drawing of this 13-year-old boy. Okay. Then the Rorschach test. Okay, finally the Rorschach was administered, and the findings of the Rorschach is presented here in this particular section. So they presented a very clear description of what were the feelings, the thought process, the fears, the motives, the drives of this particular child, and presented how the findings actually varied with each card. Okay. And finally, the exploration of the suicidal thought. So this was presented through the dialogue between the researcher and the child here. So you can see these were the questions which were asked. Since when have you had thoughts like this? Where would you commit suicide? What would your classmates have believed if you had done it? Okay. What would your teacher have believed if you had done it? Okay. Which scoring was followed to use DAP and RIBT? It is not mentioned here, but ideally it should be mentioned, right? What I think it's a qualitative, description of the drawings were presented here. Okay, so what would your mother have believed? Okay, so these questions were asked. What would your father have believed? What would your grandparents have believed? What would your brother have believed? Who would go to your funeral? Was there anybody who committed suicide in your family? So these were the questions which were asked. So this is not like a standard protocol that the researcher used. Just this was a very I can say like a semi-structured kind of interview protocol, you can say, which was used by the researcher in order to just explore the suicidal thoughts. Okay, just to understand the perspective of this 13-year-old boy about his ideation of committing suicide. Okay, so then finally the conclusion of the diagnostic process was has been presented in this part. So this is a description, okay, of the entire problem which the researcher realized from understanding and combining all the all the findings together. Okay, so that's how we can, definitely it's not the best example that we have for case study presentation. Definitely there are many others, but I showed this to you because there are many different variety of different methods which were used by the researchers to explore this problem, and probably this will help you gain more insight about how you can combine different methods together to study a particular case study. So all right, so I'll just stop here, and if you have questions, please feel free to ask. Yes.
Hello, Shati, Varsha. Is it clear to you?
Yes, sir. Yes, sir.
Okay. So now you have understood varieties approaches to write the case study, and you have understood how to analyze the data in the case study.
I will share another paper with you where you'll be able to see, how I think this one is another paper. Okay, and you can see it's similar to the previous one which I showed you, but here the conclusions are presented in a better way. So description of the problem behavior, then personal and family history was presented, dysfunctional assumptions and rules, cognitive distortions, and you see how, schematically they also presented the problems which the subject was facing, and the symptoms and the reactions to those problems. So all these things were presented in a better way, I would say. So you can use different methods. It's not like you have to have a very you have to follow or adhere to a very specific protocol for presenting your case study. You can use different methods, and you can have this flexibility to understand and compare different methods to present a case study. All right, so I will share this paper as well, so you can have a better understanding of how you can present the case study. Okay. Hope that helps.
Okay, thank you, Dr. Datta. You have covered very nicely. I think students have realized it, and some students have left. Possibly they will collect it from the YouTube. Okay.
Okay, thank you, sir. Thank you all the participants for your patient listening.
Okay.
So I'll take your leave then. Good night.
Good night.